Okay, class. In the interim, I went and found a picture of the open skull. Remember, we talked about the cribriform plate. I just wanted to show you. And remember, we said that that's where those olfactory nerve dendrites need to go through in order to smell. So I just wanted to show you what I was talking about on the cribriform plate. Okay, let's go down here now. Now, we did the immune system. And we said that the tonsils were part of the lymphatic system. And I mentioned this Valde's ring. The Valde's ring is a ring of tonsil or lymphatic tissue that's around that mouth area. Valde's, okay. We had in the back, I'm going to come here now. Let me do it this way. I'm going to use this picture. In the back up here, we have the pharyngeal tonsil, which if it swells is called the adenoid. Remember we talked about that? If it swells too much, it would close the nasopharynx from the oropharynx. Now, I'm not ready for tubal. Then the palatine tonsils, the palatine, I'm going to go to this picture here, are back in here. These would be your palatine tonsils. See that right there? That's the ones that normally swell up a lot. Then under here, what you don't see, we'll come back to this picture, would be the lingual tonsils under the mucosa of the posterior third of the tongue. You don't see those here, but they are back under that posterior third of the tongue. So you would have had these two, and then the one there. Now, some individuals, not everyone, has a tonsil right here at the auditory tube area. And those particular tonsils are called the tubal tonsils around the auditory tube. So this forms that ring. That's why just inadvertently taking out any of the tonsils is not a good thing unless there's an actual reason. All right, so I wanted to bring that up. All right, so now where we are, I want to go to this real quick as we leave the nasopharynx and start going into the mouth. What we call deglutition, ladies and gentlemen. Deglutition is a fancy word for swallowing. Now, what we want to happen is when we swallow is for food to go down into this esophagus and not go into the trachea. See how the trachea is? See, now I want you to observe this anatomy. Those that are going into nursing, sometimes you put in something called an NG tube. NG, nasogastric. In those situations, you would merely take the tube and just push it in the nose. Because of how the body is arranged, 99% of the time it's going to go straight down the esophagus. Rarely would it go and have to bend forward and go into the trachea. So what does that mean for us? What that means for us then is that the trachea is further far. It's not at the center of gravity. Because remember what I said, it's okay for air to get into the esophagus, but not for food to get into that. Okay? That means if we are going to have to put a tube in the trachea, which we call intubation, you have to go through meticulous efforts to do that, because you have to view the vocal cords and a whole bunch of stuff maybe we'll talk about. All right, so deglutition is swallowing. So we don't want food to go down into the windpipe. And we don't want it to swallow and go back in the nose. So you have what we call in the brain. We talked about centers before, clusters of neuron cells, but we have a deglutition center in the brain. The way the deglutition center does when you're getting ready to swallow is it will cause the hard palate to shift back. Now, if the hard palate shifts back, it would close the nasopharynx from the oropharynx so food couldn't enter. It would also cause something here called the epiglottis to close down over the glottis. Now, we haven't gotten to the epiglottis yet in that, but we will. To cause the epiglottis to close over the glottis. And it would cause the trachea to shift even further anteriorly so that you would attempt to put the food here. See, that's why, but to talk, hey, to speak, you have to open this area because it's coming, and so when you are talking and eating at the same time, you kind of put this deglutition center in a frizzy because this epiglottis doesn't know which way to go. That's what makes it so easy to do the aspiration aspect. All right. So anyway, that's what we're looking at there, just to kind of talk about that. All right. So now I come to the mouth here. Here's the uvula. Here's the palatoglossal arch, palatopharyngeal arch. Here's this. Here's the frenulum. Sometimes you tie-tongued and person has ankyloglossia, where this frenulum here is too short. But anyway, you would take air in through here. It would go behind here. Once it goes behind here, then it's into the what? Oropharynx. Then it's where? Into the oropharynx right there. Okay. So then we come here. This would be the oropharynx right there, because that's behind there. Then right behind, so it's nothing really to say on the oropharynx. Oropharynx, just an area behind the mouth, lined with a non-keratinized stratified squamous. Then we get right behind this area right here, which is behind the epiglottis, and we're into the laryngeal pharynx. It's just a little short area. Now see, right at the start of that laryngeal pharynx, which I mentioned earlier in this talk, that's where the fork in the road comes between you going down the windpipe and the food pipe, right before you get into that laryngeal pharynx. That's the separation that we have between the food and the air deal. Okay? So where we are now, we have now moved into, from the laryngeal pharynx, which is really nothing to say about, a little small area, to the larynx. So now what I want to talk about is the larynx area. The larynx area. All right. Now, this is the area which you looking towards me, just like this guy. You looking towards me. So you see that right there? So I come back here. That would be you looking towards me. Okay. Here, right here, is the hyoid bone. Okay. The hyoid bone is a sesamoid bone in that it doesn't articulate with another bone. Okay. Here would be the hyoid right there, and I'm going to point this out to say that the hyoid bone acts as an attachment for skeletal muscles. The muscles that are attached to the hyoid bone above are called the suprahyoid muscles, and the ones below are called the infrahyoid muscles. So it's a bone right there. Now in forensic medicine, which is criminal medicine, if this is cracked, the person kind of knows that the person died from strangulation type of thing. All right. Now, everything else besides that is cartilage. Everything besides that is cartilage. Some cartilages are single cartilages, and some are paired cartilages. So we'll talk about that. The singular cartilages that you have is this one here. Okay. This is the thyroid cartilage. Why is it called that? Because your thyroid gland is right around that area if we had the thyroid gland. Okay, that's the thyroid gland. Right here is what we call the thyroid prominence, or some call laryngeal prominence. That's the Adam's apple. So if you put your finger on the Adam's apple, you'll know above that is this area and below that is this area here. That's the Adam's apple right there. Now, between the hyoid bone, there's some dense regular connective tissue. Okay. This right here is the thyrohyoid membrane. Let me say it again. The thyrohyoid membrane. Okay. Thyroid cartilage singular. This is your cricoid cartilage. So right here is the cricothyroid membrane, or ligament, they can call it. Okay. Now, you've all heard of a tracheostomy or an ostomy. Let's say that you aspirate and the Heimlich doesn't work. Okay. Then the person could come, if they are trained. Now listen to me. Don't try this unless you've been trained. Could come and poke a hole. Take a fork or something and poke a hole right here, depending on if the food is lodged above that area. Now, if the food is lodged below, it's not going to help. But if the food is lodged somewhere above that area, in this windpipe area here, see, here's that cartilage right there. This would give me an ostomy in there. Okay. Now that's a more quick one. Here, you can do it too. It's a more permanent because you can sew it in. Here, this would be loose, but this would get your living there, keep you living. If the food is lodged above that, of course. All right. Now, this is the epiglottis right there, which is this right here. That's the epiglottis. That's the thing I told you would open and close in order to kind of close off things. Okay, that's the epiglottis. Now, you have some paired cartilages, which is called the caniculate, cuneiform, and arytenoid cartilages, the paired cartilages that you have in there also. Okay, now I'm going to come down here to this drawing here. This right here, you're looking at it turned around, okay? Here's the thyroid cartilage right there. So you're looking for, on the other side. Now, what I want to point out to you, we're going to follow the air down here. We're going to follow the air down here. All right. Right here's the epiglottis. Now, right here, these things here are called your false vocal cords, okay? Or some will call the vestibular folds. The vestibular folds are false vocal cords. Don't really know what they do, probably just to keep dust off the vocal cord itself. Right here, this little space is called the rema vestibuli. The rema vestibuli. It's a little space right there. Okay. Now, right here, that little space you see right there, that's called the laryngeal sinus. The laryngeal sinus. So rema vestibuli, laryngeal sinus. Now here, this down here, these are your true vocal cords. These are your true vocal cords. Okay? Okay? And so these are the ones that some will call them the ventricular folds. But these are the true vocal cords. This would be right there, or also, let me give the other name, the glottal folds would be the other name. The glottal, G-L-O-T-T-A-L, glottal folds for the true vocal cords. Now that space there would be the rema glottidus, the rema glottidus. So the air comes down, here it comes, that's the, and it's coming down, see that's the vocal cords, it's coming down kind of, and then it passes across the false vocal cords, then the laryngeal sinus, and it's hitting the true vocal cords, and then goes on down through the rema glottidus, and now I'm into the trachea area there. The trachea area there. Okay? But what I want to talk about on another video now, I want to get into voice. The discussion of voice now. Okay, so we're going to close this one, and then we're going to talk about speaking and singing and so forth. Okay.